Good afternoon, ladies and gentlemen. Can you hear me loud and clear? Well, welcome everybody. I will introduce myself firstly. My name is Pieter Haasnoot. I'm a Dutch medical doctor, currently finishing my training as a doctor international health and tropical medicine, formerly known as the tropenarts or tropical doctor. So I use the terms both. So when I speak of international health tropical medicine, I also mean tropical doctor. The committee asked me to hold a short presentation about the Dutch training program, which has been going on for a long time. So I will give a short presentation. Firstly, the structure, so you know what's going on. Firstly, I will discuss briefly the specialty in the old style. It's called tropical medicine. Afterwards, I will discuss the new style, which is called international health and tropical medicine. And afterwards, together we can discuss the possibilities, the limitations of this specialty. So to start, a short historical perspective. Today in other lectures we already heard a lot about how this specialty works and what it has been going on for the last 60 years, 55 years. So since the 1960s, informal training of Dutch medical doctors into tropical doctors to be able to work in research poor settings has been going on. About 3,000 thus far have been trained. Some are actually still working in the field, while others have gone on to other specialties. And so to put it basically, just shortly, what is the specialty? Firstly, you need clinical experience. This is after you've finished your studies as an MD, which is 2 years, basically first year of surgical residency. This includes ward rounds, but also operating skills. It is imperative to have operational skills when you go and work in the tropics. Afterwards, there's 1 year of obstetrics and gynecology. The main goal is that you are able to perform cesareans and do deliveries on your own. These 2 clinical years are concluded with a 3-month course of tropical medicine and public health that's arranged here in Amsterdam at the Royal Tropical Institute. And it involves 3 months of lectures on public health, also tropical medicine, neglected diseases, other tropical diseases such as malaria, HIV and AIDS. I see some of our students here in the room, so they know exactly what I'm talking about. In 1 month we will have finished this. So basically that's the historical perspective. This has been going on for 60 years. It's quite unique in the world. But now there's been a change. Since 1 year, our specialization has been embedded into the Dutch specialization system. We have thus been accredited by the Dutch Medical Association, KNMG in Dutch. But what is this and why is this? To start with, in order to have a more structured education, you need oversight. When I started my education, there was a lot of differences in the surgical years. At one place, I had little chance to gain a lot of experience, while in another hospital, they allowed me to gain a lot of experience. So through this accreditation from the Dutch Medical Association, we aim to have a more structured education. And if we have a more structured education, hopefully we can also guarantee the quality of the specialization. You have to imagine that this was an informal specialization, but it's no more. So we have to be able to guarantee the quality we deliver. Therefore, we are now accredited. Also, it has to be noted that in order to make this sustainable, we need financial support from our government. Therefore, we've also asked the government to support us financially, but thus far this has not happened. We are still in debate with the ministry. So shortly, the training program, what it looks like. First, there's 9 months. This is the new system. I discussed the old system, but this is the new system. First, there's 9 months of surgery or pediatrics. From personal experience, I can tell you that more than 90% do surgery first, and the other 10% do pediatrics. After that, there's 9 months of obstetrics and gynecology. So these are the 2 clinical internships here in Holland. Then there's the Dutch tropical course I just discussed, the 3 months here in Amsterdam. And afterwards, which is new, there's a 6-month clinical internship abroad. So you work in a research poor settings. The idea is that you gain your clinical experience here in Holland. So here in Holland you gain the first 2 clinical experiences, the 2 9 months. Then you do the Royal, the tropical course of 3 months in the Royal Tropical Institute, and then the 6 months of internship abroad. Currently we have 4 places we can send our trainees in Africa. We're also discussing other places, amongst them India. So what are the challenges we face? The Dutch government and also the Dutch Medical Association, they want every specialty to contribute to the Dutch medical system. So we have to have a way we can prove that our tropical doctors, or doctors international health and tropical medicine, that they contribute to our healthcare system. I don't know if any of you followed the lecture just before me about Jurgen van Kesteren in the Ebola area. Well, I believe that if you hear him speak, it is understandable that our training, our experience can contribute to the Dutch healthcare system. So due to globalization, migration, emerging infectious diseases such as Ebola, I believe this dual character does have a positive influence on the Dutch healthcare system. Also, the practical training in a low resource setting is now required. I have to note that there are some time restraints. It's hard to have enough clinical experience in surgery in only 1 year, but I can also tell you from experience that it is possible. In order to fill the hiatus in knowledge, we have specific course days. I will not go through all of them. I will just highlight one of them. For example, the bowel anastomosis. We will do that tomorrow. Then we practice on pig guts to make anastomosis. So, because we only have 1 year of clinical time to have experience in this, these course days are designed to fill these gaps. So when we go abroad, we know in some way what we're doing, if there's limited supervision. Also, the new education system will be academically tested, so we will be affiliated with universities in order to guarantee the quality. So what are the competences the Dutch doctor international health and tropical medicine has or must have? Of course, the clinical experience I mentioned before, but also you have to have good communication skills and cooperation, because you work in a rural setting with different cultures, and what we think is normal might not be normal. So you have to know how to discuss this with your staff and with your colleagues. You have to be able to organize this, and you have to be professional if you want to lead by example. So what are the themes we work in? Firstly, and I think the most importantly, international priorities in healthcare. Emergency settings, they require doctors, international health and tropical medicine in order to face the challenges. For example, the Ebola mission, but also the surgical need is obvious. Clinical care is what we do, but also prevention and education. In this way, you can make your contribution sustainable. So when you leave, you have people doing what you're doing, and you won't be there just for a day and then leave. Well, the intercultural aspect I discussed, and if you are at a rural setting for a long time, you can become acquainted with the local leaders and be an advocate of public health and make some changes. Like I mentioned before, in this way you can make your changes sustainable. The progress assessment in the new training in international health and tropical medicine is similar to other specialties. For example, surgery or obstetrics and gynecology, they are assessed through all in all these manners. So that's no different. Whereas beforehand it was only 2 assessments during the year. So this also makes it more professional. And lastly, I want to discuss the possibilities. I personally like to divide them into 2 main categories. You can work in a rural hospital where maybe you are the hospital director, maybe you do clinical care, maybe you do surgery, maybe you do obstetrics and gynecology. I think you have to do everything, you have to organize it, and it's a way we've seen a lot of examples that you can do a lot, but also you can do little. And another possibility is to work in international medical emergencies for organizations such as MSF or the Red Cross. Usually this is more a small group of expats doing shorter missions, but also they want Doctors International Health and Tropical Medicine to do this. I'm currently in the procedure to work for MSF maybe. And lastly, I would like to remark that when tropical doctors return, it's not as if it's time lost, because 1/3 of them actually does another specialty, go on to become a surgeon or obstetrics and gynecology mainly. 1/3 of them becomes a family practitioner, a GP, and the other third of them stays in the public health sector. They work for WHO or other organizations. And it must be noted that since this specialty is accredited, now it's possible to get discount on your specialty. So, for example, you can do your surgery in 5.5 years instead of 6 years. And also the Dutch tropical course, which we discussed, this is also about half of a master in public health. So it shortens the distance you have to learn in order to further your career. So concluding, the Dutch tropical course, International Health and Tropical Medicine, is unique, has been around for more than 60 years, and it offers great possibilities not only for the students, but I believe also for the resource low settings we work in. Questions?
Well, Pieter, thank you very much. It seems very exciting and challenging to be a doctor in international health and tropical medicine, or becoming one. But I see a finger in the back. Hans?
When you say that more assessments makes it more professional, I object to that, because that would mean that most of us have then been trained in an amateur way. I think you have to be very careful that assessment doesn't replace training. Surgical training still remains an artisan practice, and there's a lot of things that cannot be assessed during the surgical training. So I think the current trend towards ever increasing assessments distracts from the actual process of training. But that's my personal view, having been trained as an amateur probably.
Let me comment on that. I not totally agree, but almost totally agree. I believe too much assessment is useless. People don't really say what they think, and they don't actually give the feedback they should give. But the way the tropical doctors were assessed, the differences in quality there was between hospitals was so great that some more feedback and assessment, I believe, is necessary. But of course, I agree with you. It will not guarantee better quality, but I hope that some more assessment might make it a little bit better. Hopefully.
Any other questions?
One person that arrived also today, Chandrika Rao is here. She's a pediatric surgeon and now working for MSF. She's in charge here in Amsterdam in the MSF organization, and she's responsible for the surgical part of the activities. I wish you welcome here. I'm really happy that you're here. And I also would like, maybe you have some comments on this, because you work with doctors that do this kind of training. Why are they useful? What are the problems? What do you think of this new training? Do you have any ideas about that?
Thank you, Matthias, for the welcome. And I'm sorry that I could not attend yesterday's evening session. From the perspective of MSF, I totally agree with you. That there's a lot of scope for the tropical surgeon in the field out there. And since now it's mandatory for 6 months of internship, why not do it with an organization that gives you a lot of support from the point of view of security, and there's always a team that can help you, guide you, and mentor you in the actual hands-on practical aspects of tropical surgery that you will encounter in Africa or in Asia. So I think that I would like to, on behalf of MSF, actively collaborate with the Tropical Institute. And since I'm new here, I still haven't found out a lot. I need to do a lot of homework and meet with you guys in the coming year. And then probably we can have a fruitful relationship, I hope.
It's both a question and a remark. The remark is that this is wonderful to see that ultimately you're going to be having somebody who will be having a rounded, training both in surgery and in tropical tropical medicine. The question is also, has there been other European countries who have taken this, or this will be the first model? Because we have one such model in India, where I come from, which is Christian Medical College, Vellore. And long ago, they've been having this model for a long, long time. So they're the community medicine. But that community medicine doctor goes through all the training of surgery and obstetrics, and then the next 2 years of other areas. So it's a very rounded, and they do everything like cesarean section, appendectomy, all those, the very emergencies. So this question, that is it other places as well, or this will be the first one from Europe, in fact maybe in the world, which is having a stamp of the training, And the second is, have you thought about, yes, the MSF would be the practical for the surgery, but what about the, sorry, the global health, looking at the global health. World Health Organization is the one where you have volunteers and internship, etc. And this could be also part of the training, maybe 3 months or 2 months, which will actually give you the full global health picture. So this could be also, has it been thought about?
Well, I believe the way we have the education, international health and tropical medicine is unique. I know that in Germany there is a course like our tropical course of 3 months, but that does not combine the clinical experience I mentioned. So in that sense it is unique, but I didn't know India had a similar situation in one hospital. So yes, it is unique in that sense. And to come to in your second question, how we can involve the WHO in the public health education, the 3-month tropical course we are currently doing, I think 50% is public health, what we're doing. It's not provided by the WHO, but a lot of the literature we use are WHO books and things, so it is for a big part already in there, but further cooperation I think could only make it even better.